So this week is the week of getting second opinions on my bottoming out issue and whatever else. So just in general, what I'm doing, why I'm doing it. I have my appointment with my surgeon tomorrow just to kind of decide where we're going with the bottoming out. Like I've said in a previous video, he's going to fix the bottoming out issue for free on his part, but I will have to pay anesthesia center, surgical center, and new implants if I'm needing the bigger size. So I'm wanting to get second opinions so that for whatever decision I decide, that I'm comfortable and well-informed and confident in whatever I decide. Even if I do go back with pleasure, I just want to be confident in his advice as well. So anyway, today is Monday, the 26th. Today, we went and saw Dr. Kirk Moore in Midvale, Utah. Things went really great. He's actually really great. He was very informative, like very, very informative. He took his time, didn't feel rushed. So his suggestion to my problem, the thing that stood out to me the most with him is that he measured my chest from, like from here to the nipples, and he measured underneath. He even measured from like around my breast to the fold. That was good. I mean, my initial surgeon didn't do that at all. So just based off just measurements, he suggested that I needed an implant that had a diameter that would complement the 14-inch, or was it centimeter? 14 centimeter.
16 centimeter.
16 centimeter, space that I had here. So right off the bat, he was great in that way. He suggested that I would need about I should have done like a 500-ish around there implant even to begin with. Anyway, the biggest question with all these surgeons is, do I need a lift? And I told him about all the extra tissue. It's not even really that I don't need my nipple lifted. My nipple to breast fold ratio has always been normal, great, not even borderline needing a lift. My breasts just sit lower on my chest. I guess they just look kind of like they're saggy just because of how long my chest is. They're not sagging down to that point. That's where my breast fold starts. So if that makes sense. Okay, so yeah, the biggest question is, do I need a lift? And he said I don't. He did all the measurements, and he said that he agrees with pleasure in that sense, that I don't need the lift. If we did the lift, it's gonna put my nipple up in disproportionate places according to my fold. You can't move the breast fold up. It's like telling a doctor to move your arm into here. Like it's just not possible and feasible and whatever else. So anyway, so yes, first surgeon suggests no lift. He also suggested doing textured implants. The textured implants are going to help with the bottoming out and slipping out of pocket and things like that. He also suggested, obviously, a bigger implant. So yeah, I feel like it went good. He was very informative, really great guy, really nice. He was very upfront as well. He is how did she word it? He is a plastic surgeon, not a cosmetic surgeon. So his prices are a little bit higher than normal anyway. But I don't want to base what I'm going to be doing off of price. I want to go with the best option. And so yeah, that's the first surgeon. And we're gonna I see pleasure tomorrow, and then I see 2 surgeons on Thursday, and we'll kind of go from there. And yeah, one other thing that he suggested is that I wait a long time to have this issue fixed. He suggested at least 6 months. He said preferably like a year to wait to even get this fixed. Because for him, the way he's going to do things is he's going to use the capsule, whatever. When you get an implant, your body naturally forms a capsular whatever, basically like scar tissue around it. He wants me to wait 6 months to a year for the sole purpose of having that like tissue buildup, basically the capsular whatever, so that he can take from that and basically make a support hammock type deal underneath to support that, if that's making any sense. It made sense when he said it, but so there's that. I will update you guys tomorrow as far as what pleasure says. should be good.
Belly.
Should we go get Bailey? All right.
No, we should go get Billy.
You want to go get Billy? I love you. I love you.